You're checking a mole on your shoulder in the mirror. Asymmetry, border, color, diameter. You run through the checklist you half remember from a poster at the dermatologist's office. Your arms look fine. Your back looks fine. You feel briefly, smugly safe. That's the whole ritual most people have for skin cancer. Scan the parts that see the sun. Ignore the rest. That ritual misses the deadliest kind almost entirely, because there's a form of melanoma that doesn't care about sun exposure at all. It grows on the soles of your feet, the palms of your hands, under your fingernails, even inside your eye. Doctors call it acral lentiginous melanoma, or ALM. Most people have never heard the term until it's already stage 3. Here's the basic biology first. No jargon left hanging. Melanoma starts in melanocytes. Those are the cells in your skin that produce melanin. Melanin is the pigment that gives skin, hair, and eyes their color. Normally, these cells divide in an orderly way. Melanoma happens when a melanocyte's DNA gets damaged badly enough. The cell starts dividing out of control. It forms a tumor that can eventually spread or metastasize to other organs. In the version of skin cancer everyone's warned about, that DNA damage comes from ultraviolet radiation. UV light breaks the genetic code inside sun-exposed skin. Simple story. Wrong story, at least for the type that's about to matter. Acral lentiginous melanoma grows in exactly the places the sun never touches. The word acral just means at the extremities. Hands, feet, and nail beds. These cells were never sitting under UV light in the first place. So the genetic damage that triggers them looks completely different. Researchers have found that ALM tumors are frequently driven by mutations in a gene called KIT. KIT normally helps regulate cell growth. These are not the classic sun damage mutations found in melanomas on your arms or face. So the #1 public health message about skin cancer is, wear sunscreen and avoid sun damage. That does almost nothing to protect you from this version. Not misleading, just irrelevant to it. So how would you even catch something growing on the sole of your foot? You wouldn't, mostly. And that's the second layer of the problem. A 2023 review in the Journal of Clinical Oncology noted that acral melanoma tumors are routinely mistaken for something harmless. They can look like bruises, plantar warts, or fungal infections. Sometimes they go misdiagnosed for years because nobody inspects their soles with the same paranoia they apply to their face. Under the nail, it's worse. Subungual melanoma is melanoma specifically under the nail plate. It often first appears as a dark vertical streak in the nail. Almost everyone assumes it's a stain, an old injury, or a fungal infection. There's a specific warning sign doctors look for. It's called Hutchinson sign. That's when pigment leaks from the nail onto the surrounding skin fold. If you've never heard of it, you're not alone. Most people learn about it only after a diagnosis, not before. Now stack a second mechanism on top of that. Melanocytes don't only exist in skin. They're also present inside the eye in a layer called the uvea. They also exist inside mucous membranes like the mouth, sinuses, and gastrointestinal tract. That means melanoma can start in your eye, or in tissue you'll never see in a mirror at all. Uveal melanoma is the eye version. It occurs in roughly 5 people per million each year in the United States. It's rare, but it is still the most common primary eye cancer in adults. It's often found incidentally during a routine eye exam because it produces no pain or visible external symptom until it's already advanced. Those are locations nobody is screening on their own, ever. Here's where the stakes stop being abstract. Bob Marley, in 1977, noticed a dark streak under the nail of his big toe. He was told by more than one doctor that it was likely the result of a soccer injury. It was subungual melanoma. It went unaddressed as a soccer injury for years instead of being treated as cancer immediately. Eventually, it spread through his body. He died in 1981 at age 36. His case is one of the most cited examples in dermatology literature of the diagnostic delay acral melanoma produces. Not because doctors are careless, but because the lesion looked exactly like something mundane. Here's the part that should genuinely alarm you. Acral lentiginous melanoma makes up only 2 to 3% of all melanoma cases in white populations. That sounds small, easy to dismiss as a rounding error. But research published in the Oxford Journal Clinical and Experimental Dermatology found that ALM is the most common form of melanoma in Black patients. Sun exposure isn't the driver, so it occurs at similar rates across every skin tone and ethnicity. Yet public skin cancer messaging has spent decades telling people with darker skin that they're essentially not at risk. That messaging isn't just incomplete. For this specific tumor, it's backwards. 5-year survival for ALM averages around 80%. That is notably lower than survival for common sun-driven melanoma. The same research ties that gap directly to one thing. These tumors are caught later, on average, than melanomas anywhere else on the body. Not because the disease is inherently more aggressive in every case. Because nobody was looking. So what can you actually do about a cancer that grows somewhere you never check? Honestly, not everything. You can't UV-proof your way out of a mutation with a completely different cause. And you can't personally screen your own eye tissue or nasal lining. But you can extend the checklist you already run on your arms and face. Check 3 places most people skip entirely. The soles of your feet, your palms, and your nails. A new dark streak under a nail deserves attention. So does a spot on your sole that isn't healing, or a persistent dark patch on your palm. Any of those gets a dermatologist's attention, not a guess. And an annual dilated eye exam is important too. It's the boring appointment most adults put off. But it's currently the only realistic way uveal melanoma gets caught before it becomes symptomatic. So go back to that mirror. You're still standing there. You just cleared your arms and your back. You feel that same brief safety. Except now, flip your hands over. Look at your palms. Sit down and actually look at the soles of your feet. Really look. Don't just glance. The cancer you were trained to fear is the one hiding in plain sight. Sunburned and visible. The one that actually catches people off guard has been sitting quietly in the dark the entire time.